Good evening, everyone. My name is Mia Johnson, and I am the Health Committee Chair for the National Coalition of 100 Black Women Incorporated. It is my honor to facilitate this program this evening, Caring for the Caregiver and Barriers Faced by Black Caregivers. It's my pleasure to introduce to you NCBW's National First Vice President of Programs, Rhonda Rogers, who will bring greetings.
Thank you, Mia. On behalf of NCBW and LLS, I bring you greetings. Is there a better way to kickstart our programs for this year? No, our health and well-being is very important. It is my great esteemed pleasure and honor to introduce our National President of the National Coalition of 100 Black Women, Madam President Elizabeth A. Jones. President Jones is currently serving in her first term as national president. She was elected on October 9th, 2021. She has served at both the local and national levels. During her tenure, she successfully served as chapter president for the Greater Cleveland chapter, the national membership chairperson, the National Audit Committee chairperson, the Executive Board of Directors, the Board of Directors, and our National Third Vice President of Membership and Chapter Development. She is a respected leader with over 45 years of combined experience as an executive, nonprofit, and leadership experience. She is a principal owner and CEO of Brown, Jones, and Dansby Financial Services, Inc., a full-service accounting firm in Beechwood, Ohio. Before transitioning to the public sector, she enjoyed over 20 years of executive leadership as a public health care administrator for the Metro Health System, a nationally ranked nonprofit health care system in Cleveland, Ohio. She served as the first Black female administrator during her tenure. President Jones' motto is, "Life is not about waiting for the storm to pass. It is about learning to dance in the rain." I present to you our National President, Elizabeth A. Jones.
Thank you, First Vice President Rogers and Chairwoman Johnson. Good evening to all. It is my honor to bring greetings on behalf of the National Directorate and all the activist women in our 62 chapters and 26 states that comprise the National Coalition of 100 Black Women Incorporated. NCBW was founded in 1981 in New York City and is a 40-year-old advocacy organization whose vision is that Black women and girls will live in a world where social, economic, and equity does not exist. Our theme this evening, Caring for the Caregiver and Barriers Faced by Black Caregivers. Caregiving is nothing new to Black women. In fact, it is something we do organically. We do not even question the toll that it may have on us. As we are here today, I am sure that each of you can name at least one person that is taking care of their mother, their father, husband, or sibling, if you are not that person yourself. It was reported by the National Alliance for Caregiving and the AARP Public Policy Institute that in 2021, around 53 million Americans are providing unpaid care for relatives and or friends. And over half of those caregivers are women in their late 40s and early 50s. You see, when Black women go into informal caregiving, oftentimes it is not planned, it is not practiced, and there is no instruction book. And although caring for a loved one can feel rewarding and fulfilling, caregiving takes time, energy, and resources, all which impacts and affects the caregiver. Caregivers maintain tasks such as shopping, food preparation, housekeeping, laundry, transportation, among other daily living for both themselves and their loved ones, often while still being employed and taking care of their immediate family. There is no doubt that the role of caregivers is important, but caregivers cannot fulfill their caretaking role if they are not taking care of themselves. It is important to continue to have discussions like the one we're having today in order to not only better equip ourselves, but to be able to share the information with the next generation of caregivers. Thank you to the Leukemia and Lymphoma Society for granting us this opportunity for information and tools that will enable us to care for ourselves as we care for others. We will now show a brief video. The program will be turned back over to NCBW's National Health Committee Chair, Mia Johnson, our facilitator for this evening's program. Thank you.
Thank you, President Jones. Thank you, President Jones. The video we just saw is a reminder for some and educational for many regarding the services provided by caregivers. It is an honor to be with you this evening to share knowledge about an important subject matter, caring for the caregiver and barriers faced by Black caregivers. Now I will introduce you to our esteemed speakers for the evening. We have Erica Pomares. She's the Senior Manager and Patient and Community Outreach for the Leukemia and Lymphoma Society, the Gulf Coast region. Erica oversees and executes the local implementation of education programs and outreach initiatives to serve and support families impacted by a blood cancer. She connects patients and caregivers to community resources and support services, including LLS's Information Resource Center, where highly trained oncology social workers, nurses, and health educators can assist patients through cancer treatment, financial and social challenges, and give accurate, up-to-date disease treatment and support information. We also have Laura Ortiz-Ravic. She's the Director of Outreach and Health Promotion for the Leukemia and Lymphoma Society. Laura oversees the execution and evaluation of programs that serve and support medically underserved populations, particularly Black Americans and Latinos affected by blood cancer. Among those initiatives, she is responsible for the implementation of Myeloma Link, a national outreach program that seeks to raise awareness of the higher incidence of myeloma among Black Americans. She has helped establish LLS as a leader in services, advocacy, and access for blood cancer patients by forging partnership with important local and national community partners, particularly those serving vulnerable populations. We also have Kim Young, who's a caregiver to her late mother, Carolyn Young. Kim Young served as a coordinator in her family in facilitating her mother's medical and physical care. Kim, along with her father and siblings, rallied together to provide spiritual, emotional, mental, physical, and medical support to her mom during her bout with multiple myeloma. Kim honors her mom's legacy by volunteering with LLS to educate, support, and forge understanding of how multiple myeloma affects Black American communities. We also have Reginique Ruffin, who's the information specialist at the Leukemia and Lymphoma Society. She is currently an information specialist in the Leukemia and Lymphoma Society's Information Resource Center, where she assists patients and caregivers impacted by a blood cancer through financial and social challenges and gives accurate, up-to-date disease, treatment, and support information. She is also skilled in providing in-depth psychosocial support and disease education to those affected by blood cancers. Her expertise includes mental health and oncology social work. In addition to her work with blood cancer patients and their families, she also has experience working with children and adults with psychiatric diagnosis. She earned her master's degree in social work from Clark Atlanta University and was awarded her Bachelor of Arts in Child and Family Studies with a minor in psychology from the University of Louisiana of Lafayette. She is currently a doctoral student, earning her PhD in social work. We appreciate you all for being with us here today. So we're going to kick off our discussion with Reginique. Reginique, our first question to you tonight is, who is considered a caregiver and what does caregiving look like, especially in the Black community?
Absolutely, absolutely. And so a caregiver is anyone who is providing care for a loved one. And so if you are someone who is consistently caring for a person with who has a serious illness, you are a caregiver. If you're helping someone with his or her daily needs, such as making food, bathing, dressing, going to doctor's offices or groceries, then you are a caregiver. If you're providing any ongoing medical, emotional, or practical support for someone, you're considered a caregiver. And so it's important to note that the experience of being a caregiver is going to be unique for each individual person. So while there are some similarities in a type of care that's normally provided, your specific experience as a caregiver may be different than someone else's. And so pretty much as was already stated, most times the role comes on gradually and most people enter into the role without any thought of it, right? Especially in the Black community, it's often thought as the right thing to do, right? And so it's our way of giving back and really taking care of the people who have taken care of us. So oftentimes we take on the role of the caregiver without thinking about it.
That's very true. I definitely am seeing some faces as you give that definition within our community and some of my family. So you're right about that. My next question, what are some of the best strategies to avoid feeling overwhelmed as a caregiver? Or what tips can you share to help caregivers organize themselves?
Okay. And so the number one way to avoid feeling overwhelmed as a caregiver, number one is going to be to ask for help, right? And so part of what helps us cope better within the Black community is the expectation among us that our family and our community members, that we're going to look out for each other. But with that being said, you have to reach out and you have to be honest and vocal about your needs. Number two is going to be to seek psychosocial support, right? And so connecting with support resources. Number one, you can join a support group, right? Support groups provide us with a safe place. They're a safe place for people who have similar situations to find comfort. And so engaging in a support group may be beneficial to you as you provide care for your loved one. Another way to avoid feeling overwhelmed is engaging in individual therapy to help prioritize your own mental and emotional needs. Lastly, another way to avoid feeling overwhelmed is by connecting with your loved one's social worker or their treatment team to determine if there are any additional resources that you and your family can take advantage of. And so some of those resources may be respite care or home health services, or any additional resource available to help meet some of the needs of your family. And so research actually shows that the Black caregiving role may lead to worse health outcomes. And it's because there is a lack of formal support, and there's also increased barriers to accessing culturally appropriate services. So making sure you're communicating and connecting with your loved one's healthcare providers is going to be critical, not only to their health, but also to yours as well. And so in terms of staying organized, we know that life as a caregiver can sometimes be hectic, and it's easy to become overwhelmed with the number of things that need to be completed. And so staying organized as a caregiver helps you reduce the stress because it's a way to prioritize tasks and also prepare for what's to come. And so one way to stay organized is by setting some type of daily routine or schedule that works for your family. And so a daily routine can help you anticipate what's to come, and it can also ease some of that stress because it not only allows you to anticipate what's to come, right, but it also helps you prepare for these things. And it's also beneficial for the loved one, the person that you're providing care for, because it provides them with a sense of security because they know what to expect as well. And a schedule, creating a schedule, right? A schedule that helps you be realistic about the tasks that need to be accomplished and the time you have to get those tasks done. It also helps you plan how you're going to spend any free time that you have, right? So if you notice that on a Tuesday, you have 2 free hours, you can think ahead of time about how you like to spend that time. So creating a schedule is definitely another way to stay organized. And the last thing that I would say is try keeping all of you all's documents in one place. LLS actually provides a very efficient caregiver tote bag that helps you stay organized, whether it's keeping track of side effects, medications that your loved one is taking, or simply having a place to write down the questions that you like to ask their healthcare providers. Having that information in one place is very helpful, and it's also another way to stay organized.
You said something that stuck out to me, and the word was prioritize. So my next question is, why is it important that caregivers prioritize taking care of themselves?
Okay, absolutely. And so caring for a loved one and at the same time, possibly worrying about what the future holds for your family is exhausting, and it can lead to burnout, right? And so caregiving can be a full-time job, and most caregivers will just keep doing what needs to be done while neglecting their own well-being, or they'll feel guilty when they do take time for themselves. And so it's interesting because I was listening to a TED talk by a caregiver, and he said something that stood out to me. And what he said was, he said, caregivers have to learn how to be selfish to survive. And research actually shows that 30% of caregivers will die before their loved ones. And some are dealing with their own medical issues while caring for their loved one. So prioritizing your health, prioritizing yourself as a caregiver is so important. And sometimes we can see it as a luxury, right? And sometimes that's where the guilt comes in, because it's like, how can I take time for myself when I need to be taking care of my loved one? But we have to understand that prioritizing yourself, it's not a luxury, it's a basic human right. And so prioritizing self-care is so important, because in order to take care of someone else, you have to be in a place to do so. And so that doesn't just mean taking care of your physical health, that also includes prioritizing your emotional and your mental health as well.
Right.
Yeah.
Absolutely. It looks like you sparked a couple of questions from some of our attendees.
Okay.
The first question is, how different is the stress experienced by a patient versus that experienced by a caregiver?
Okay. Yeah, I think the stress experienced by both the patient and a caregiver are equally significant, but they're very different. And so hopefully the patient can focus on receiving treatment and getting better, but that's not an easy task, right? That can include dealing with pain, that can include long hospital stays or treatment, or just being the one who has received the diagnosis, right? But the caregiver, on the other hand, oftentimes has to carry the other responsibilities, like assisting with activities of daily living, right? Assisting with their ADLs, giving medication, providing transportation to doctor's appointments, cooking and preparing meals, managing the household and finances. Some caregivers are still working full-time jobs on top of caring for their loved one. Some caregivers are having to deal with difficult treatment decisions, right? They're the ones who are having to make these really difficult decisions or communicating with their loved one's healthcare team, all while still being that person for their loved one and providing that emotional support that their loved one needs. And so while I think that both a patient and a caregiver may experience stress, the type of stress that they experience and the extent of that stress is going to be very different for each person.
Got it. And I have one last question, just moving
Okay.
into this pandemic. How has COVID exacerbated the burden of caregiving for Black caregivers?
Absolutely. Okay. And so it's become clear to us that the COVID-19 pandemic or the COVID-19 virus disproportionately affects communities of color. It's been made clear to us, right? And so African American older adults are 3 times more likely to die from COVID-19. So it's clear that there has to be a focus on providing support, not only to this community, but to the caregivers specifically who are bearing the brunt of the pandemic, right? And so those who are caring for their loved ones, their children, all while also trying to take care of themselves. And so some of the burdens that I've seen have been that Black caregivers they're providing care in isolation. Of course, having to limit their loved ones' exposure to COVID-19 means less help from other family members and friends because they don't want to, they don't want too many people in the home, potentially exposing their loved one to COVID-19. And so this isolation can also lead to depression and negative health outcomes, right? So both caregiving and COVID-19 pandemic separately, they both affect your mental health, but when you combine them, they're even more overwhelming. And so also many other caregivers are still raising children. And as you know, some schools are going virtual or inconsistently shutting down if there's any exposure. So there is some inconsistency that can cause stress on a caregiver's part because they're having to find childcare, possibly taking off from work and risking not getting paid to care for their loved ones and for their children. Many caregivers are having to navigate complicated health systems that aren't necessarily culturally competent are skilled in understanding the unique needs of Black families. And they're having to do it all virtually, right? They're not able to go with their loved one to their appointments. And so they're having to reach out to a primary care provider or, a specialist and having to wait for a call back. And just that waiting period alone has been so stressful on caregivers, right? For some caregivers, the pandemic has been like the last straw, right? Because the role is so complex and oftentimes overwhelming. Adding a pandemic on top of it has caused them to find themselves in a crisis, in desperate need of support. And so this is why it's so important to communicate, be vocal about your needs as you need them, right? So be vocal about your needs as they arise to your loved one's healthcare provider and to their treatment team, and to also prioritize your own health. But it's also a call for healthcare providers just to be aware of these disparities and provide services to help meet the needs of our community.
Wow, that was some very valuable information, Rajanique.
Absolutely.
And this leads into another informative conversation as we never know who's taking care of others. So following this video, we will talk with Kim Young, which is the caregiver for her mother.
Runs a cultural diversity program for a nonprofit senior center. Here, she discusses her family issues.
I'm caring for my mother and my aunt, and I help them a lot around their house and get into appointments. They both have a form of cancer. I also have children at home, so that's an extra load there. There was some times when I went to work very tired and just to balance home, and I had to stay focused on my kids. They were in school and we had to get up early for the buses and that type of thing. So there were times when it was a long 24-hour day, very long. At Nesco, it's the perfect job because I can take it home. I can do phone calls at home. I mean, I don't have to be there to do my work. And so that helped a lot. My supervisors made it easy in understanding that as long as I got my hours in and my time and everything, it went good. I mean, I've never had a problem. I've never even had to say why I was off, as long as they trusted me enough to have that flexible time. And it's important that they take note of people who are taking care of their families, because a lot of, especially for African American families, they usually don't put their families into a nursing home or assistant care program. They're usually either right in their home or somewhere close where they can keep an eye on them themselves. So I think it's important.
Kim, thanks for joining us this evening. It's obvious that caregivers must be patient and have a heart to care for others. My first question for you, can you share your caregiving story with us? When and how did you become a caregiver?
Sure, thank you. I just want to first say thank you to LLS and NCBW for allowing me to share our family story. It's just not my story, but it's my family story and how we cared for my mom. Um, I'm grateful and humbled by this experience because we were intentional in how we cared for my mother. Um, from my dad to my siblings to the grandkids, we all played a part in caring for my mom. Um, when we think about being a caregiver, I think about our role in my family, and we all had separate roles. So, for instance, I'm the point person, and I was affectionately called Sergeant of Arms. I had my older sister who was like our PM. She was our project manager. We had my younger sister who was our decoder, or she would just translate the information, whether it be medical or if it was Kim talk, she was able to translate that to my siblings or to the grandkids or to whomever, to my dad. And then you had my brother who was like our enforcer, and he was in charge of logistics. And then you had my dad, who was a crucial part because he was our motivator, he was our spiritual leader and our advisor. So when I think about all of us coming together, I think of that movie Drumline, because we really kind of had my mom at the center, and we were one band and one sound. And that's how we kind of got through all of the difficult times that my mom had treatments and things of that nature. Also, when I think about a caregiver, I thought about how our roles morphed into more than just being a caregiver. We might not have had what you would call formal education, but we became financial advisors. We became financial planners. We became a social worker at times. In some instances, we were experts in trying to disseminate information to my parents and things of that nature. So I look at this in totality, and we as a family, we did it together. We all took part, we all played a part, and we were so fortunate enough that we had a very great support group that, you know, were our extensions to caring for my mom. So that was pretty much our journey. I would speak on, you know, maybe us having courageous conversations. Reginique spoke about, you know, like long-term care and hospice and things of that nature. Those are those conversations that are challenging. And a lot of times in the Black community, we're, one, not prepared sometimes. Number two, we don't want to talk about it. But I encourage our family to have those courageous, what I call courageous conversations, so that we were prepared and what was next to come in my mom's treatment. And through that, I think we all came together. We made decisions. Ultimately, it was up to my mom and dad what, you know, the final decisions were, but we all came together, and we just kind of came together as one unit, so that we knew that my mom was receiving the critical care that she needed. We made sure that doctors were clear in what their delivery was, or what their message was, or what the treatment was. So that was kind of our journey. And I realized that not all families have that. So it's important to have a support group that kind of rallies around that caregiver to give them that extra support or needed support to be able to, you know, maybe transition to other things. I think Reginique even spoke about, you know, possibly doing shopping and things of that nature. So that was pretty much our journey, and how we kind of rallied around my mom and made sure that my mom was at the center, because I referenced the drum line. She was our heartbeat. She was that beat that kept us all together. So that's how we came together, and that's how we cared for my mom.
Right. So then, what type of support? I know you mentioned your family, but what type of support outside of that did you rely on to fulfill your role? as caregiver?
So we're a family of faith. And so we heavily relied on our church families. And I'm using the word families plural because we just didn't, connect with just one church or our local church or the church that we belong to. We had support from a lot of churches that we were affiliated with. Also, our extended family, my mom's side and my dad's side, they were so supportive in helping us get through some of those difficult times. There were times when I might not have been able to take my mom to treatment, or my dad wasn't, or my siblings. So we relied on some family members to help us do that. And so that outside support, those extensions that helped us get through that, that's what really carried us through. We had family friends that helped us, that encouraged us, that sent cards, that just, kind of gave us that inspiration that made us not feel like it was just us that we were going through, but it was like all of us. We're all going through this together, and that we can get through it and make it. And not only just make it, but kind of forge through. And then at the end, we're like, okay, so mom went through this. Okay. And she got the treatment, and now, yes, okay, she's doing good, and she's, forging on. So we just kind of relied on a lot of support and a lot of encouragement from our friends and family.
So then, how did you deal with the stress of being a caregiver during COVID?
So COVID in and of itself was, as Reginique said, it was just all off on its own. And so with that, like I said, we're a family of faith. So ultimately we relied on God's protection. However, we were practical. So we maintained good hygiene. We made sure that we limited my parents' exposure to outside sources. So we used the modern means that was there. We did online shopping. And in some cases, we weren't allowing the grands to come around them. I know we missed Thanksgiving dinner, our first Thanksgiving dinner that none of us were together, and we did it virtual. So it was kind of, it was kind of weird at that point, but ultimately we knew we had to do that in order to keep everybody safe. But COVID did present its challenges. There were times when my mom had to go in to her doctor's appointments, and my father and I were not able to go with her. So we just got creative. I'm like, Mom, use your cell phone. We're going to have a conference call while you're in the office, and I'm going to be able to listen in and hear everything that they're saying. And we did conference calls, we did video calls and things like that. So COVID presented its own challenges. However, we were able to meet those challenges.
Okay. Well, Kim, as a caregiver, I know your job wasn't easy, and it is evident that you have a heart of gold. We have a lot of questions that have come in, but we have time for one. So I'm going to ask you one question. How did LLS help you cope with your role as a caregiver?
Sure. So with LLS, they were so resourceful. We had several questions about some of the treatments and some of the clinical trials, and we were able to reach out to them to get that information. They even put us in touch with other families that were going through the same issues that my mom was going through. So they were just like that beacon of light, and they were able to just give us those answers that we were, needing at the time. And even with the staff, before I started volunteering, some of them were even reaching out. And then I'm like, okay, I got a letter in the mail, and I'm like, you know what, I'm just going to start volunteering. And then, during those times I would have check-ins. They would just check in on me. How's everything going? Just that support there was great. And then at the time when my mom did pass last year in May, it just the outpouring of love from the LLS organization was just so great. And I'm just so grateful to have been part of it. And I know my family is definitely grateful.
Great. Thanks, Kim, so much for sharing your testimony today. I'm sure those who are caregivers in our virtual audience can relate to your story. So I want to thank you again for your time and for sharing your journey with us. We will close out with our last speaker of the evening. Erica Pomares is the Senior Manager of Patient and Community Outreach with the Leukemia and Lymphoma Society. First question, Erica, good evening.
Hi.
So, can you tell us more about the Leukemia and Lymphoma Society and the work the organization does to support patients diagnosed with the blood cancer and their caregivers?
Absolutely. Thank you so much, Mia. So as the leading source of free blood cancer information, education support for patients, LLS helps patients and caregivers navigate their cancer treatment and ensure that they have access to quality, affordable, and coordinated care. Research will help us achieve an end to cancer, and LLS has invested nearly $1.3 billion in research since 1949. In the meantime, we realize that patients need help before, during, and after their diagnosis and treatment.
Okay. So can you share some of the programs and the resources that LLS offers to support caregivers of patients with blood cancer?
Yes, so LLS offers free support and services. All of these services can be provided to families right in the comfort of their own home. We have an amazing team of information specialists who are master's level oncology nurses and social workers. Rajanique is once part of that team, and they are an essential point of initial contact for personalized disease treatment and support information. Specialists continue to provide important answers from how to navigate changes in the healthcare insurance coverage to how to balance caregiving and work and share LLS financial resources for blood cancer patients, and also help families navigate childcare at home. In addition to all of that, they can provide caregivers with free educational material. For example, we have a wonderful caregiver free workbook available. Caregivers can also choose to connect with weekly online chats moderated by a social worker, or connect with others on LLS Community, an online social network with 15,000 plus members. There's also a caregiver group on LLS Community. Our wonderful First Connection program is an incredible resource. Caregivers can speak to a highly trained LLS volunteer with a similar caregiver experience over the phone. Caregivers can talk with someone who has really been through it. The other service consists of free nutrition support for any cancer diagnosis and for caregivers that are caring for a patient, disease education through our local virtual patient education programs.
Wow, that's amazing. With that in mind, how do you reach the community members, especially the Black community? Are there programs that are specifically designed to serve African Americans impacted by a blood cancer?
Yes, and thank you so much for this opportunity to share what LLS is doing in this space. We are meeting where patients are. We have a powerhouse team of patient and community outreach managers in the field across the United States, whose main role is to connect with patients, caregivers, cancer centers, the healthcare professionals, in the cancer centers, and also community organizations across their region, and to share LLS trusted services and support, as I mentioned earlier. An example of one of our outreach initiatives is our Myeloma Link program. The Myeloma Link program has two goals, and it's to educate African Americans communities about myeloma and to help patients in these communities navigate the treatment landscape more effectively and cope with the disease. If you ever like to get involved, anybody with this program, please do not hesitate to reach out to us. We have a plethora of outreach, and we would definitely welcome your help.
And one last question, how can people reach out to someone at LLS for more information about support services for patients and caregivers?
So they can call and speak to one of our information specialists at 1-800-955-4572. And I'll put that in the chat as well.
Thank you so much. Thank you, Erica. You have educated us on information that we all need to know. And so now at this time, I will turn the program back over to NCBW's National First Vice President, Rhonda Rogers.
Thank you, Mia. That was truly an informative and candid conversation. Thank you to everyone who joined us this evening. And thank you so very much for the caregivers in the audience. We see you, we value you, and we are here to say thank you to you. I would like to also give a special thank you to the Leukemia and Lymphoma Society for not just bringing more awareness to the barriers faced by Black caregivers, but also highlighting the different resources that Black caregivers can use. I want to thank our phenomenal speakers, Erica Ramirez, Laura Ortiz Rabbit, and Reginique Reffin. The tools and incitement information you gave us was well received, and we thank you for your time and your dedication to this great program. And Kim Young, thank you, Ms. Kim Young. Thank you for your selflessness with your work that you did for your family and your mother, and thank you for sharing your story with us here this evening. I would like to also thank our facilitator, Mia Johnson, our National Health Chair, as well as our wonderful webinar producer, Bridget Baker. I cannot go without thanking our corporate staff. They do a wonderful job. Thank you very much to the corporate office staff for all that you do. And before we leave, we'd like to turn the program back over to hear closing remarks from Laura Ortiz Rabbit with LLS. Thank you for being a partner.
Thank you for those questions, Rogers, and thank you to our remarkable panelists. Your willingness to share your personal stories and expertise are deeply, deeply appreciated. The Leukemia and Lymphoma Society is honored to partner with the National Coalition of 100 Black Women to reach, serve, and support communities impacted by a blood cancer diagnosis, especially those facing significant barriers to care. We hope you enjoyed tonight's program. Thank you again for your attendance and see you next time. Thank you.